Welcome back. So every year in August, South Africa marks Women's Month to pay tribute to the more than 20,000 women who marched to the Union buildings on the 9th of August back in 1956. They were protesting against the extension of past laws to women. A new generation of women is now taking the baton forward, and joining us now is a woman who I imagine fits that mold. Dr Ntombi Sigwebela is joining us to share her experience in the health sector. The good doctor is a seasoned public health leader and a medical doctor with more than 20 years experience delivering large-scale infectious disease and health programs across the Southern Africa. Dr. Sigwebela, it's lovely to have you on the SABC News channel. Thanks very much indeed for making time to speak to us. And it's, let me say upfront, difficult to distill 20 years of experience in this 10-minute discussion. But let me just get, as a start, a sense of how would you describe your experience as being among those seen as shaping health systems, not only in our country, but also in Southern Africa?
Thank you very much for having me this morning. It's been quite a long journey, but a very rewarding and interesting one. And as a woman, especially a Black woman from South Africa, having to navigate all the intricacies of delivering care to people in lower and middle income countries hasn't been that easy. But having joined Health Systems Trust, which is an NGO that has worked with the South African Department of Health for many years, over 33 years, making sure that our health system is robust enough and has all the necessary requirements to deliver excellent services to the people of South Africa. I think that has made my journey traversing through both local entities and learning from those who have been successful either abroad or in our neighboring states. We have come far, and I think that's what brings us here today.
Yeah, absolutely. And you know, when we speak to many experts and look at the research, we find that women, at least when compared to their male counterparts, are more likely to take their health seriously. But that notwithstanding, we're finding that there are still many women around the world, and I imagine in our region, who are struggling to have access to such medical help.
That is true to some extent, and I think looking at South Africa and where we are, a lot has been done to deliver quality services, but women still face a lot of challenges in terms of access. As much as clinics are available everywhere, but accessing them, be it transport, the availability of money to get to the transport. And what's even more important, once you get to the facility, how long do you wait? And how long does it take you to get out of there? But what is critical at the moment is the awareness about common diseases that affect and cause death for many women in the country, like cervical cancer. The knowledge and understanding of how easy it is to screen for such diseases is complicated also by the referral systems that are challenging to most women and therefore cause delays in diagnosing the diseases and also delays in treating the diseases. As givers of care, women face a number of challenges as well around safety issues, harassment in the workplace, as well as navigating between cultural norms and what is required in the work environment, leading to all sorts of problems. And most importantly, trying to balance the work life and making sure that your mental health status remains intact throughout all of this. So Health Systems Trust is part of the solutions to this through the work that we do in our implementation science, where we look at systems that are easier and accessible and can be delivered to the right people at the right time, especially for women. An example is the work that we do on delivering cervical cancer screening and cervical cancer vaccination programs for women in their communities, instead of expecting them to have to find the means to get to the facilities to receive this kind of service.
Yeah. And, I wonder what your experience is, Doc, but certainly in my small bubble, I am learning of a whole lot more women who are, learning that they are developing all manner of different cancers. And I suppose in the past, there was always a perception that, especially the Black community isn't necessarily susceptible to this. Does this, my experience that is, match with your own findings, that in fact, there's a whole lot more of an urgent need for people to make sure that they can get early diagnosis? Because we do know that, with diseases like cancer, it is a race against time.
Yeah, certainly. I think your experience is not out. A lot has been done to try and educate women around these diseases, but also a lot has been done by civil society to try and bring the knowledge that is required for both the women themselves and the healthcare providers that deliver these services to ensure that it is working. So in South Africa, we have a major problem with cancer of the cervix or the womb, and also cancer of the breast. One of the major problems is not knowing and not being aware of the signs and symptoms. And also once you know, not knowing where to go. So we come in as Health Systems Trust to make sure that we educate communities around these diseases, not just the women themselves, but their families, so that they are also able to identify the signs and symptoms when they occur. But also, most importantly, to ensure that communities understand that there are preventative means that would help to identify or diagnose the disease earlier, and ensuring that you receive the treatment timelessly, so that the quality of your life improves. We work together with the government and the communities to ensure that we deliver services that are accessible to
Dr. Sigwebela,
people that need
I'm terribly sorry to have to interrupt you.
Sure, for example, that we're working with government to provide mobile clinics that go out into the community, and with nurses and other healthcare workers in them, making sure that diagnosis is made.
Dr. Sigwebela, I'm so sorry to have to interrupt you. My sincerest apologies, given how important this is. We just have to pop out of that discussion, as important as it is, to take you to the Pretoria High Court.